EGFR mutant lung cancer as a whole is about 10 to 15% of lung cancer in North America, but in other parts of the country it's much more common. In Asia, for example, it's more like 30 to 40% of lung adenocarcinoma. Out of EGFR mutant lung cancer, exon 20 mutations are about 10 to 15% of that group as a whole. We think of EGFR mutation lung cancer in a few different groups. We think of the classical mutations. The two most common classical are L858R and the exon 19 deletion. And those are the ones that respond to our first and third generation inhibitors. And then we think of the atypical mutations. The atypical mutations include exon 20. It's about half of the atypicals. And it also includes some like exon 18 mutations as well. So if you put all that together, exon 20 EGFR mutant lung cancer is about 1 to 2% in North America and 2 or 3 times that in Asia. So it occurs with some frequency, but it's relatively rare compared to classical EGFR mutations. As you know, for classical EGFR mutations, the L858Rs and the exon 19 deletions, they respond extremely well to the first generation inhibitors, drugs like gefitinib and erlotinib, or a second generation like afatinib, and they respond as well to third generation inhibitors. This is where exon 20 mutant EGFR disease is really different than the others. So if you take all the studies that are out there, and there's not a lot of large studies, but if you piece together the different studies that are out there, the response rate to exon 20 mutations to standard first-generation drugs is about 3 to 8%. And that 3 to 8% really consists of responses to one particular mutation, what's called the 763 FQEA, and a second mutation called the S768I. But if you take those two mutations out, basically exon 20 mutations do not respond to any of the standard available drugs. Exon 20 mutant non-small cell lung cancer overall appears to carry a little bit worse prognosis than regular EGFR mutant lung cancer. There are some studies out there saying that they have a higher prevalence of brain metastases, they've got slightly more aggressive disease. Now, with that said, the studies are very small, and it's a little hard to separate, is this because the disease is actually more aggressive or just because we don't have any good standard therapies for it as well. If you look at the response to standard drugs, our standard inhibitors, the normal progression-free survival for classical EGFR mutations would be 12 or 13 months or so. For exon 20 mutations, it's only about 2 months. So these patients really do not get a lot of benefit from first and second generation drugs, unfortunately. And this really highlights the pressing need for better drugs. Now, these patients can respond to chemotherapy, they can respond to immunotherapy, like other types of lung cancer. So it's not that they don't have any options at all, but so far we don't have any targeted therapies that are approved for patients with exon 20 mutations.